House and Senate Democrats have been very clear that we will support a bipartisan spending agreement that meets the needs of the American people in terms of their health, public safety, and economic well-being. Meaning, legislation that makes life better for everyday Americans as opposed to continuing to make life more expensive for the American people. House Democrats have been clear that we will not support a partisan Republican spending bill that continues to gut the health care of the American people. That's not a clean continuing resolution. It's a dirty spending bill, and one that is unacceptable. This country is in the midst of a Republican assault on the health care of the American people. Republicans have ended Medicaid as we know it. Millions of people have lost or will lose access to their health care coverage. We confront a possible cut to Medicare of $536 billion all across the country as a result of the Republican assault on health care. Hospitals, nursing homes, and community-based health clinics are closing. Millions of Americans face the likelihood of dramatic increases in their health care premiums, co-pays, and deductibles. Republicans have launched an unprecedented assault on medical research, including research for children with cancer. In addition to attacks on the Centers for Disease Control, vaccine availability, and the public health infrastructure that has existed in the United States of America in order to keep the American people safe and healthy. Republicans have launched an unprecedented assault on the health care of the American people that is unconscionable and immoral. And it's our responsibility here in Washington to make sure that we aggressively push back against it. Questions?
Republicans are trying to censure Ilhan Omar for some of her remarks about Charlie Kirk here. What do you think your responsibility is as the leader of the Democrats to curb rhetoric that might be inflammatory, and specifically that woman?
We have made clear that political violence directed at anyone in any way or in any place is unacceptable in the United States of America, and every member of Congress and certainly the President of the United States have a responsibility to take the temperature down and ensure that we are lifting people up. There are many people who have doubled and tripled down on inflammatory rhetoric in the aftermath of the killing and assassination of Charlie Kirk, who hold extreme views outside of this institution. And the question that should be asked is, has the president brought the rhetoric down? Calling people sick, is that a reduction in rhetoric? Calling folks who are calling for retaliatory violence or suggesting that one could care less about bringing the country together, is that the leadership that this moment requires? I think we need to come together, not as Democrats or Republicans or independents, but as Americans. That's a responsibility for everyone. I haven't seen the Nancy Mace resolution, presuming that that is what you're talking about. Nancy Mace wants to lecture Ilhan Omar and Democrats about civility? Are you kidding me? It's not a serious effort. It's an effort to drive donors into her gubernatorial campaign.
Do you think that she has gotten the message, meaning Omar, the message to bring down the rhetoric?
I haven't read the Nancy Mace resolution, so I have no idea what Nancy Mace is talking about. But the notion that Nancy Mace is trying to send a message to Ilhan Omar or any of us is ridiculous. It's ridiculous.
If Republicans can get to the CR, to the number needed for the CR, what is it Democrats want as their, like, what is your bare minimum to come back to the negotiating table?
We're not going to negotiate in public, but what is clear, as we've said, is we will not support a partisan spending bill that Republicans are trying to jam down the throats of the American people that continues to gut health care. No one who is following what Republicans have done to rip away health care of the American people can reasonably suggest that responsible legislators should do anything other than push back aggressively to protect the health care of the American people and make sure that millions of folks don't have to deal with dramatic increases in their health care premiums, co-pays, and deductibles. Life in Donald Trump's America is already far too expensive. Donald Trump hasn't lowered the high cost of living, which he promised to do on day one. Costs aren't going down, they're going up. And Republicans have set in motion dramatic increases in the health care expenses of the American people, and Democrats are fighting hard to reverse it. I mean, the question here is, at what point are we going to find a path forward so that the divestiture, which was the main principle in the legislation that was passed by Congress over a year ago, can take place? There is no interest in a tick-tock ban, but there is interest in divestiture so that TikTok is not owned by the Chinese Communist Party, a strategic adversary of the United States of America.
Can we expect to see any kind of Democratic alternative in the House or Senate to the CR legislation?
We'll cross that bridge when we get to it.
Mamdani again. Can you share at all, like, your time frame or like what you're weighing as you think about this decision? And I know you said no one's expressed frustration to you, but Senator Chris Brown Holland last weekend sort of called you out and other members of the delegation. So, what's your response to that?
I think we had a response to that.
Thank you, Mr. Leader. Could you speak to your positions on the two DC crime-related bills that are getting a vote later this afternoon?
Those aren't bills that are serious efforts to address public safety in the Washington, D.C. area, and it's not my expectation to support them. Donald Trump is the president. He's a Republican president. Republicans have a majority in the House, and Republicans have a majority in the Senate. And we, as Democrats, have been very clear that we will support bipartisan spending legislation that meets the needs of the American people in terms of their health, public safety, and economic well-being by driving down the high cost of living in Donald Trump's America, which is far too expensive. Donald Trump made clear that Republicans want to go it alone. And he indicated publicly that he has no interest in talking to Democrats because he has no interest in dealing with the Republican-created healthcare crisis. Republicans have devastated Medicaid, are going after Medicare. Their behavior has resulted in the one big ugly bill that will close hospitals, nursing homes, and community-based health clinics all across the country, including in rural America. The Republicans are unwilling to extend the Affordable Care Act tax credits which will result in dramatically increasing the premiums, copays, and deductibles of at least 20 million Americans. As a result of the Republican assault on healthcare in the United States of America, healthcare premiums for tens of millions of people who are on private insurance are going to skyrocket as people receive notices over the next several weeks. And as we approach open enrollment on November 1st, Democrats are going to continue to stand on the side of the health care of the American people, and Republicans are clearly trying to gut it. That's the battle line that has been drawn. And there is an opportunity for Republicans to reverse course and actually do something about the healthcare crisis that they have created, including by enacting the largest cut to Medicaid in American history and devastating their own constituents. It's our view that we have to resolve this issue sooner rather than later because of the fact that notices are going to go out in a matter of weeks to millions of Americans who will be shocked by the fact that their health care premiums are about to skyrocket, in some cases by tens of thousands of dollars. And the open enrollment period will start on November 1st, which is why this has to be resolved sooner rather than later. The thing that's interesting is that Republicans have put forth a partisan spending bill that fails to address the fact that tens of millions of Americans are about to experience dramatic increases in their health care premiums and have done nothing about it because they could care less. They don't give a damn about lowering the high cost of living in the United States of America, but Democrats do. And that's why we've drawn a line in the sand as it relates to defending the health care of the American people and refusing to back partisan Republican legislation that will gut the health care of everyday Americans. The Republican partisan spending bill that they introduced is not clean. It's an attack on the health care of the American people that is continuing, and it's a dirty piece of legislation. Thank you.